Mayor Mike Bazicki and I, along with my council colleagues, are pleased to welcome you to Wilmington and appreciate your attendance here today. It's great to see such a great turnout as we cultivate more than a year's worth of work with the presentation of the CDC's Community Advisory Council's final report entitled Accelerating Youth Violence Prevention and Positive Development, a Call to Action. Today, I will provide a brief overview of the road traveled to get to this point and highlight 6 recommendations of the network of services that can and should be strengthened to prevent youth violence and promote positive youth development. Before I begin, I want to acknowledge the CDC Community Advisory Council members. Will they please stand and give them a round of applause for their work? I want to express my sincere gratitude to the Advisory Council co-chairs, Dr. Henry Smith, former Deputy Cabinet Secretary of the Department of Health and Social Services, Dr. Smith, and Mr. Darrell Chambers, Research Assistant for the University of Delaware, and Dr. Gwendolyn Aguilette, Staff Support to the Advisory Council. Thank you. Again, I'd like to thank all of you so much for your time, talents, and strong commitment to children, youth, and families in Wilmington and beyond. Shortly, we will hear from Governor John Corning, Lieutenant Governor Bethany Hall Long, Delaware Health and Social Service Secretary Rita Langworth, and County Exec Matthew Myers. But I want to thank them for being here in full support of this important work. In particular, I would like to thank Secretary Langworth for her full support in implementing the recommendations of the CDC, which has led us to this final report. Thank you, Secretary Langworth. We are also pleased to be joined from the representatives from the General Assembly, Representative Nicholas Brock, who's representing Senator Margaret Rose Henry, and State Representative Stephanie T. Bolden. From Wilmington City Council, Councilman Namdi Chirocha, Councilwoman Xanthia Oliver, Councilwoman Yolanda McCoy, Councilman Cyril Adams, Councilwoman Rashima Dixon, and former Council President Mr. Theo Gregory, former Council Member Kevin Kelly, and currently the Director of Parks and Recreation for the City of Wilmington. We're also pleased to have the following representatives from the office of our congressional delegation: Lori James, State Director for Senator Tom Carper, Mr. John Paoli, State Director for Senator Chris Coons, and J.J. Francis, Outreach Coordinator for Senator Coons. At this time, I am pleased to invite Mayor Mike Bazicki to the podium to give remarks at this time.
Thank you, Hanifa. Ladies and gentlemen, I'm really pleased to be here. When this started sometime back ago, when Hanifa first introduced this concept of going to the CDC, I have to tell you, I wasn't an enthusiastic supporter. I didn't quite understand where she was heading on this, and here I am today, frankly humbled by my lack of foresight. And I want to congratulate you, Hanifa, on a remarkable courage and insight into the problems that we have in not only our community, but throughout communities throughout our state. I look at this as an opportunity to reimagine the solutions to dealing with the problems that afflict our neighborhoods. We have short-term solutions, of course. We have to deal with them as public safety issues. And these are just regrettable realities that we have to deal with. But secondly, we've always talked about long-term solutions. We've talked about rebuilding our neighborhoods, strengthening our neighbors, treating our crime problems not as problems distinct in of themselves, but as symptoms of deeper problems. What the President of Council has done is introduced another layer, a very important layer of having all of our support services function as wraparound services, working together, being accountable to one another, creating an urgency of dealing with the support services that our young people need so desperately. And I look forward not only to the further details of our plan, but I look forward to having our administration being full partners and full supporters of this effort. Again, thank you, Madam President. And I'm so pleased to have the governor, the county executive, lieutenant governor here. It's an augury of what we can expect in our state, dealing with problems not as individuals, but as people all working shoulder to shoulder in pursuit of the same lofty goals. Thank you very much.
Thank you, Mayor. Your strong support and commitment to working collaboratively to address this epidemic plaguing our youth is vital to our efforts. The CDC report issued in November of 2015, which examined youth firearm violence in Wilmington, recommended that an advisory council composed of key community stakeholders be established to provide recommendations on proposed evidence-based integrated services to be provided to youth who are found to be high risk of committing violence. The council includes 38 representatives from the school districts, community-based organizations, the faith community, the Cease Violence Program, Delaware Divisions of Public Health, Prevention and Behavioral Health, and Youth Rehabilitative Services, the United Way of Delaware, City of Wilmington's Mayor's Office, and the Wilmington City Council, but most importantly, community youth, their families, and advocates. The fundamental goal of the Community Advisory Council was to develop for the City of Wilmington strategies, programs, services, policy adjustments to prevent youth violence, and to promote programs to promote positive youth development. Early on, the council decided to focus its efforts upstream from the population included in the CDC study in order to intervene earlier with youth to interrupt the cycle of violence before the youth go into deeper crisis. Accordingly, the council decided to focus its work using a public health approach on the population of citizens ages 4 to 24 living in the highest need neighborhoods of Wilmington. Through its data collection and analysis, the council found many community programs are using evidence-based or promising practices in their work and demonstrating positive impact. They found that not enough programs, services available to reach all of the youth who need them, such as work readiness and employment programs for older youth. They found services are not well integrated. While there are some examples, more work needs to be done on service integration, both at the client level and at the policy governance level. We found need for more case management or care coordination, support for moderate to high-risk youth for a longer period of time. And we found the need for more trauma-informed practice to be embedded in our school and community programs. Consolidating all of the data and research, the council developed the following 6 recommendations. First, to foster violence-free environments and promote positive opportunities and connections to trusted adults. By establishing universal services for all youth living in high-needs neighborhoods and expanding the capacity of community centers to provide year-round quality program after school and evenings, 7 days a week, and invest in a year-round employment program for young youth and young adults. For example, Earn and Learn. Number 2, intervene with youth and families at the first sign of risk with selected services for youth at moderate risk. Develop a multi-tiered identification and referral system to be assessed by families, schools, community organizations, and healthcare providers with options for self-referral to connect youth to needed services with case management. Test these approaches in a middle or high school, community center, or healthcare provider. Number 3, restore youth who have gone down the wrong path. Coordinate indicated services for high-risk youth active with the Department of Services for Children, Youth, and their families, and increase the level of support for youth transitioning back to the community by developing a one-stop youth wellness center at community centers modeled after the Hope Commission Achievement Center. Number 4, protect children and youth from violence in the community, increase support for outreach programs that engage the community in creating a culture and environment that prevent violence and promote positive youth development, support existing efforts to embed trauma-informed practice in every aspect of working with youth and their families to foster community resiliency, to combat the negative impact of adverse childhood experiences on individual and community health and well-being. Number 5, integrate services. Develop and pilot a model for the integration of services for youth, children, and their families, engaging school districts, schools, community organizations, hospital systems, and key state agencies. This would include a common platform for sharing student data and service information, and have a school-based coordinator to make the connections to needed services. Create a state-level children's cabinet with an advisory group of representatives from the nonprofit, business, and philanthropical communities to integrate policies, programs, services, data sharing, and resources at the state system's governance level. And number 6, address policies that have unintendedly adverse consequences for youth. Includes difficulties with the sharing of client data among state agencies, such as the Department of Health and Social Services, the Department of Education, and the Department of Services for Children, Youth, and Families. The sharing of information from schools and hospitals to improve early detection of problems and connections to needed services with case management. Also, the transitioning of youth back to traditional public and charter schools from alternative settings to complete their education and graduate. The recommendations contained in this report are aligned with and further supported by the work of other collaborative efforts focused on improving the education, health, and well-being of Wilmington's children and families, including the Wilmington Education Strategy Think Tank, Wilmington Educational Improvement Commission, and Delaware Center for Health Innovation Healthy Neighborhoods Committee. In order to fully implement the report's recommendation, the Council calls for a financing plan to improve the use of existing and proposed new appropriations to address violence and crime. Currently, nearly all of these funds are being applied to the after effects of violence and crime. The challenge is to devise strategies to use relatively marginal sums of these resources and apply them to support the use of evidence-based and promising practices that demonstrate positive outcomes related to preventing youth violence and promoting positive youth development, and promoting integration among these services for synergistic effects. The members of the Council believe that citizens of the state of Delaware deserve a better return on their investments in government efforts to address crime and its after effects. There is no better plan to make a focused investment into children and youth and strategically deploy limited resources to achieve positive results. We are pleased to have support from all levels of government of the state of Delaware, which is paramount to our efforts to successfully implement the recommendations highlighted in this report. At this time, I would like to give our special guests and collaborative partners an opportunity to make brief comments. So I would like to call on Governor Jack Markell, then Lieutenant Governor Bethany Hall Long, Secretary Rita Landgraf, and County Executive Matt Meyer in that order to give remarks. Governor?
Jack.
Did I say Jack? Did I say Jack? Yeah. I promised I was going to say John. And it's written John. Please forgive me. Oh, gosh.
Thank you very much. Thank you very much, Council President Gregory. Thank you for inviting me and all the state officials who are here, and to Representative Stephanie Bolden, who's sitting in the front row. We want to thank you for your tremendous work in bringing this CDC report to reality. I remember you coming to my office when I was Delaware's lone congressman to tell me this was an idea that you had and you wanted me to get behind it. And it was pretty clear from the beginning that you either got behind it or you got out of the way, and I was right there with you. And the recommendations that you read, and you recognized the members who are here in the audience and the elected officials. I want to thank all of them for their work, particularly Henry and Gwen and Darrell. I see Henry and Gwen there in the front row. I don't know where Darrell got to. In the front row, too. Sorry, Darrell. And your colleagues, Secretary Landgraf, for really a tremendous work. And we all know how important it is. We all know how important the success of the city of Wilmington is to the success and vitality of the state of Delaware. And Mr. Mayor, Madam Council President, if we're not able to address the issues of public safety in our communities, which have plagued us now for years, this is not a new problem. We're not going to be as successful as a city and as successful as a state. It's really, really important for those individual kids growing up in those neighborhoods. And having lived in the city now for about 30 years, raised my two boys here, I know a lot of those kids. They're young adults now, by name. We're not only going to fail those kids and their families, but we're going to fail our city and our state. The mayor already has reached out to County Executive Meyer and myself for our assistance as we come up with a new law enforcement approach. And that's important, but it's not going to do the job. We have to look at the recommendations in this report and do a better job making sure that all of our young people grow up with the support that they need to be successful, the education they need to compete in a very, very competitive and challenging world. And if there's one thing that we have here in Delaware that ought to give us optimism that we can actually move the needle on this, is our great tradition of working together. And that's why I couldn't be happier to be here with all of you, with our chief executives in the city of Wilmington and the county, and pledge to all of you to provide the leadership that we need at the state level to basically do the coordination that these recommendations are requiring, and to put the resources behind those recommendations, whether it's deploying existing resources, finding new ways to do things, or whatever it takes. We are all in. Count us all in. And we all have to be all in. We all have to be all in if we're going to make this work. We can't be looking for ways to pick at it and say, well, I don't agree with this, or I don't agree with that, or whatever the case may be. We're going to have our differences. Let's focus on the things that we can agree on to move our city and our state forward. This is going to be hard work. Believe it or not, what y'all did was the easy part, with due respect to all the great work that you did. The hard part is in front of us. But I am really confident that with the leadership that we have, and with the buy-in of all the members of council, members of the legislature, members of county council, we'll be able to do what's necessary. I am under no illusion about how difficult it will be. And by the way, it has to start with our schools, so that every kid gets the kind of education that they need to be successful. And I just, again, want to end by thanking Hanifa again for really putting your shoulder into this thing and bringing it home with, I think, recommendations that we can all get behind that will move the needle forward for our kids and for our city and for our state. Thank you very much.
Thank you very much. As Governor Carney had indicated, this issue is multi-tiered. And I want to start by giving a shout out. I know Hanif and I have spent the last year and a half talking about this great report. And as our governor just stated, we're going to have to take it off the shelf, out of the binder. And as I look out in the audience, our colleagues from the legislature, the city council, county exec, mayor, it can't just sit there. And as I look at a former colleague and student, Gerald Chambers, through the University of Delaware, and Henry Smith, and with Rita, it really does boil down to working with you in the community. As a public health nurse myself, have spent a lot of time on the streets of Wilmington and know the corners and the zip codes, and it's something that we can talk about, but it's not going to happen without the community leadership and family members and with the community. So we're just very excited. As the Lieutenant Governor's office, one of the items I know, working closely with the governor and our partners behind us, I've made a commitment to really outreach to make a difference for those 9,000 teens who suffer with mental health and substance issues each year. A lot of that is related to a mental health illness that hasn't been treated. I've made that commitment working with our partners in the schools, whether it be our school nurses, our counselors, and certainly our faith-based collaborative clergy. Without our diversity, we're not going to be as successful. So I am enthusiastic. I'm excited. I particularly love the latter couple of comments that are provided, that we have to share our data, work closely together on the street, in the community, with moms, with parents, and really give a lift up. And the final thing I'll say is yesterday, Governor Carney's been there. I had my first day on the Board of Pardons as Lieutenant Governor, and I have to share with you the one theme that resonated, that I was so really committed to, that we all have been committed to this past year and a half in this discussion, and to Henry and others, is that I would say 95% of the cases that came before us yesterday started as juvenile delinquency and issues in our teen community and individuals who struggled. So I am optimistic. I think, like all of us behind us, the glass is half full. I know that there are a lot of things that we can do together, and we will do together. And I just am excited to get my sleeves rolled up to partner with everyone behind me, but in particular, the diverse groups in the community who really know the issues. So with that, I will then turn this over, I think, to, you don't want it yet, Secretary Landgraf? Okay. Secretary Landgraf is pointing me in a different direction, and we will certainly miss her. She's been a steady force, I know, behind the work in the community, and I'm excited that you're going to the University of Delaware to continue community engagement. So with that, I'm being told to turn this over to our county executive, Matt Meyer.
Thank you, of course, to Council President Shabazz, former Councilwoman Shabazz, who got this all started. I really appreciate it. Of course, to the mayor, the governor, lieutenant governor, and Secretary Landgraf. Also to all of you for coming today. We have a lot of the people we need in the room here today, but not enough. Not enough. About 3 years ago, I was teaching about a mile and a half from here at Prestige Academy, and I was tutoring one of my students after school. I won't forget this. He said he was complaining. It was about this time of year, right after Christmas, and he'd gotten a computer from his mother for Christmas. Of course, Michael was complaining the software wasn't good enough. He was doing real well in my class, so he said, "Mr. Meyer, will you just talk to my mom and make sure she knows I'm doing well in the class, so she'll go and buy me the software." I said, "Michael, why don't you do what I did when I was a kid and get a paper route? You can earn money, spend, we did the math, 5-6 months delivering papers, and then you'll have enough money, Michael, to buy your own software." And he looked up at me and said, "I can't. My mom doesn't let me go outside during the daytime." It's not acceptable in the city of Wilmington in 2017. It's not acceptable in Newcastle County in 2017, or in the state of Delaware, for that matter, in this country, that there are kids who don't feel safe going outside their houses. That's not acceptable. And I realize all of us have come here today to start to address that. We spend an incredible amount of our resources, of our taxpayer resources, on addressing violence after the fact. Somebody shoots, Think of all the resources, the policing resources, the legal resources, the corrective resources we deploy, we invest, and we must invest to keep our neighborhoods safe. You always hear people say, how do we take some of that and invest it a little earlier in the process? Invest it to give kids opportunities rather than to lock up adults for years and years. The problem with that is that policymakers, you don't know how to do it. There are so many different ways you can do that. There are so many different ways to invest in prevention. And that's why what Hanifa has done is so valuable, because it at least starts to give us a playbook. And today is another step in developing that playbook. I just want to end something I learned as a first-year teacher from one of my mentor teachers. I care deeply from the first day I went into the fourth grade classroom to teach. But I learned very quickly that caring was not enough, that I could care a lot about my students and I could work day and night for my students, but that didn't necessarily mean I would educate my students. And I think similarly, all of us here, we can work hard together and we can care a lot, but that's not necessarily enough. We need to be smart. We need to bring people together. We need to look at the data and the information and learn as we go forward to make sure we are making progress. Because I think, as all of us up here know, it's an emergency and it's something we need to get working on right away. Thank you very much.
I just want to echo what has been said before. Up until this point, we've been reacting. We've been reacting to the trauma that we have seen in our city. And now with the CDC, and thanks to Hanifa. Hanifa, come up to the podium with me. Oh, sorry, Channel 10. But up until this point, when the CDC came in, and why this is so paramount, the CDC typically does not do research relative to gun violence. They're actually prohibited from doing that level of research. But they wanted to look at this from a public health perspective, like a disease, and the trauma that is associated with this level of violence. So they landed here in Delaware, in the city of Wilmington, looking at our data, and then looked at what was the common indicators that impacted those individuals who committed gun violence. And through that research and through that data, they provided us with a predictability model. And because they're public health scientists, they looked at how can we intervene for those who are at the highest level of leading to the perpetration of gun violence. How can we intervene and how can we prevent this? This is really complicated and complex. I cannot speak on behalf of the CDC, but Dr. Summer, who was our scientist dedicated to this work, was very proud of this work, but even prouder of Hanifa's dedication and commitment to seeing this through, and then to convene the advisory council that really then put more recommendations together, which is what you're seeing today, that can lead us to preventing violence. This is the only work of this kind that has been promoted throughout the United States of America. So all eyes are on us, on you, in order to take this to the next level and then promote this model, not only here in the city of Wilmington, but throughout our beautiful first state, and then even across our borders to other states and cities. So I just wanted you to know how huge this is, and if it wasn't for this champion next to me, this would never have occurred. So thank you, Hanifa.
Ooh, I said I wasn't going to get all teary-eyed, but I see my mother over there, and she got me going here. But thank you so much to everyone and all your comments. And I lost my place where I'm at. This has been, well, let me get back. As we conclude this press conference today, I would like to start where it began. Before I do that, I would like to recognize my council member, Councilman Vash Turner, and congratulate him on his great efforts of calling a call to action. Congratulations on your success. But the decision to reach out to the CDC to investigate the epidemic of homicides in Wilmington was both personal and part advocacy driven. My family has experienced firsthand the pain and suffering caused by violence. Fast forward to 2007, and already we've seen a record number of shootings. Who knows if this senseless acts could have been prevented? We don't know. But we all know that we have a moral obligation to do everything in our power to reduce the likelihood that these crimes, and more importantly, the underlying cause associated with this public health epidemic, will be handled. Now the real work begins, and I look forward to all of you continue to partner and doing the great work that you're doing, but do it in a collaborative, planned out way to bring a complete end to this senseless violence that's killing our children. Thank you.